This is Community Connections airing on OROMIA11. I am your host, Anna Orr, and today is a very special edition of Community Connections. We will be talking about Men's Mental Health Awareness Month, which is this November, and we'll be talking about Early Childhood Mental Health Awareness, which is also this November. This is going to be a wonderful episode you won't want to miss, and hopefully this will help you navigate the men and or the kids you have in your life and give you some tools to better navigate your mental health. Stay tuned. Hi, Shavita. Thank you for joining me today.
Hi, thank you for having me.
Can you introduce yourself to our viewers and talk about your role?
Sure. So my name is Shavita Prasad. I am a school psychologist by training, and right now I'm working in the role of a mental wellness and academic specialist at Hopkins High School.
Okay. Now, we know that November is Men's Mental Health Awareness Month, as well as Early Elementary Mental Health Awareness Month. And I found that to be really important because, as it keeps getting cooler and cooler, we notice an uptick not only in people being inside more, but also experiencing a lot more isolation around the holidays. I'm excited to have you join me so that we can talk about the importance of not only addressing mental health, but also navigating it within our own networks. Can you talk to me about what you've witnessed to be some of the most prevalent mental health issues at the high school dealing with the students that you work with?
Mm-hmm. So I think, in response to all of the things that we've been dealing with across the world, specifically COVID-19, right? The COVID-19 pandemic. Many scholars are coming with symptoms and signs of depression and anxiety. Many are struggling with the stresses that they have in response to all of these changes that they've had. And they're struggling with having the stamina to be able to come back in a space when they've been at home for quite a long time. So I would say in my personal experience, I've seen a lot of signs and symptoms of what we would describe as anxiety and depression. And, depending on the scholar or the student, it might be for various reasons. And so we may not give that label, but we think about the characteristics or what comes up for them. It can look like anxiety and depression.
Okay. Now, I just read something interesting, and I want to make sure I get this right, so I'm going to look down just to look at my notes. According to the Health and Human Services Office of Minority Health, African American students are 2 times as likely to be diagnosed with suicidal ideations, depression, and have mental health issues than their Caucasian counterparts. And I found that statistic to be so alarming. Can you kind of talk about some of the contributing factors to that in our kids versus that of Caucasian students?
Mm-hmm. So that's an interesting statistic that you found, because it's often that members in the Black community are often undiagnosed for various reasons. Sometimes there's stigma, sometimes there's lack of access to resources and opportunity to get those diagnoses. So I find that really interesting. I would imagine that has to do with, in terms of our community being potentially more surveilled or having more opportunities to be brought up as struggling with our mental health, in some ways, in a way that's negative, right? So that is a bit surprising, but I would say that it comes up when you think about the stressors that contribute to why someone would have anxiety or depression. We are more likely in our community to struggle with poverty. We may struggle with the effects of the pandemic in a different way than our white counterparts. With having, parents that aren't able to work, we may be more likely to struggle with coping with that financially and socially and emotionally. So it's likely that it's absolutely, in my observation, it's very likely that our scholars of color are may struggle. I wouldn't exactly say more, but in a different way than our white counterparts, and it looks differently, if that makes sense.
That makes a lot of sense. Can you talk to me more specifically about what you witnessed with your scholars after they returned to in-person learning coming out of the quarantine time with COVID-19?
Yeah, so I think that both students and staff were excited to be back in person. So when we came back, it was kind of a false idea of normalcy. So when scholars came back, they were able to be in proximity to their friends. When during the pandemic, when we were at home, they didn't have that opportunity, but we still had to follow different safety measures to be able to make sure that we were safe. So we still had social distancing. We all still had to wear masks. We had to do contact tracing. And it was just not what many people expected when they came back to the buildings. So many scholars struggled with this change being, having the stamina to be able to be in a class all day, or be in learning settings all day. When they were online, they had shortened periods of, work time, and they were able to take breaks, and they were able to wake up a little bit later. And so many of our scholars struggled with having the stamina and the ability to be in an academic setting for the majority of the day. And so we tried to support as much as we could, but we're still dealing with the effects of the pandemic for our scholars.
Now, we've talked a little bit about COVID and how kids were navigating, and parents not only being within the home and then now making their way back to work. Can you talk to me about what the actual definition of anxiety is? I know that oftentimes we hear the word thrown around, and I don't think people actually know what the definition actually means. Can you provide that for us?
Mm-hmm. Mm-hmm. So anxiety, and I have to say that even though I'm a school psychologist, we don't typically diagnose our scholars. So we look at the symptoms, like how are they showing up?
Okay.
And so in the schools,
around anxiety.
Yes. So scholars may come in our space somewhat withdrawn. They might be sensitive or nervous about different things that are routine. They may have difficulty with changes in their routine. They may ruminate or stress about things that they hadn't before. And so you see them worrying about things in a way that they didn't before. And it's to a point to where it's impacting different parts of their lives. So all of us fall on a spectrum of having some anxiety, and some of that is normal, right? So we may have, our heart may race when we are about to do a presentation, right? We might get nervous or wonder about what people think or say about us, when we are doing different things. But anxiety is to the point to where it significantly impacts our life and our functioning and different relationships that we have. So someone who potentially is clinically diagnosed with anxiety might be so anxious that they may not be able to perform well at work in the ways that they can. Or they worry so much about doing something right that they spend so much time trying to make it perfect that they aren't able to do other things that they need to do. Sometimes it impacts personal and family relationships, and it can prevent one's ability to, be their best selves.
I think all of those have been, all of those descriptors have been, I think, very telling, but also I think we've seen them much more than we actually realized and didn't know necessarily what to call it. So I'm grateful that not only you provided some of the symptoms, because I know that oftentimes when we see children, or we may see our significant others, and we know how they are traditionally every day, but subtle changes start to happen over time. And you may not necessarily know what you're looking at. So I'm grateful to not only hear that. Can you talk to us about what depression is and some symptoms around depression, so that if someone is encountering that, like I said before, they're kind of able to kind of help define what that is or what they're seeing?
Right. So someone who has signs or symptoms of depression, they're in a space of being really down, not being able to motivate themselves, potentially in a place of hopelessness. So likely, when we are discouraged by something, we'll go into a low place. Like we might have, sad or negative thoughts. We may feel really frustrated about our situation or our skill set in an area. For someone who is depressed, they don't naturally move up from that type of situation. And so where we may feel really bad about, let's just say, failing an exam, right, for a scholar may interpret that failure as they are a failure as a person. They will never be successful. They continue to not be successful. And so that thought process impacts their whole life and the way in which they function. So likely you will see people who, sleep a lot, who are depressed. You will see potentially people who have a lot of negative thoughts of themselves, and seem to just be in a place of hopelessness. But there's variability in that. And so I want to be clear that some people are functioning with depression and you wouldn't see it. Many adults are functioning, and youth actually, it has become their normalcy. And so you may not be able to see it. But when you look at the thought patterns that they have, it is likely that they could potentially have depression. So that negative sense of self, that hopelessness, and an overwhelming feeling of not being enough.
Now, we talked about a sense of hopelessness. How did you see the effects of the George Floyd case and trial affect scholars within your institution?
So it's interesting how it's shown up. In some spaces, we don't really have the opportunity to kind of explore scholars' perception of the things that are going around, in the world. And so we often provide safe spaces for our scholars to be able to talk about what's going on in the world in spaces like my office, right? So mental health support staff provide that. But often when our scholars walk out of these spaces, they are expected to focus and be a student, right? And so I saw many of our scholars being overwhelmed and not being able to focus on their academics. I've seen scholars really struggle with the idea that we're expected to kind of go about business as usual. I'm supposed to focus on math when this is happening in my country, right? Or this is happening in my state, right? And so there were often times where we had to give our scholars grace. We had to provide opportunities for our scholars to just vent and share their fears, their concerns, and what they felt needed to happen to make things right. And we worked really hard to provide that for them. But it was overwhelming, and for our scholars, I think, in relation to what I had just talked about, a feeling of hopelessness, like it's not going to change. And so, we worked to try to help our scholars move towards a space of action, and sharing their voice and their perspective with their school community.
I think it's really important that you guys have been able to hold space for scholars to deal with their emotions, but also to begin processing their feelings. I know that so much of the timing of this civil unrest didn't really allot, I feel like, for parents and other people in the part of the village to kind of connect or even describe some of those feelings in real time, because we're all encountering the situation in real time ourselves. I know that we spoke earlier about contributing factors for depression and anxiety being, the cold temperatures, it getting dark sooner. But I don't think people really navigated Thinking about also, like you said, civil unrest, witnessing ongoing community violence, the opioid crisis, suicide in our communities.
Right.
Things just kept coming within that time frame that I don't think really allotted for people to begin to process their feelings. Currently, it states that there are 25% Black people seeking mental health treatment within the United States versus 40% of our white comrades that would then seek out mental health treatment. I find that number to be twofold. Surprising that it's so low, but also, again, not surprising that 40% of white people are also receiving mental health treatment. Can you speak to those numbers and kind of how you witness that every day?
Absolutely. So there is absolutely a reduced percentage of people of color and specifically Black communities accessing mental health services. And that is for various reasons. And it's interesting, I explored this in my dissertation too. There are various factors that contribute to underutilization of mental health services. One would be, but not the primary, is stigma, right? So in our community, it is, we generally in some spaces are not comfortable with seeking mental health supports. When we think about the formal definitions of the different mental health disorders, they don't contribute to the lived experiences that we all have. So some of us potentially have, may have signs or symptoms of these different disorders, not because we have the medical predisposition or we have, regardless of what is going on in our life, we would have depression or anxiety or whatever. Many members in Black communities, not all, may have life experiences that may lead to hopelessness, right? That may contribute to having increased stress, that may make it difficult for one to be able to cope. And so it is likely that potentially we don't feel comfortable with the formal diagnoses having to be diagnosed in order to receive support and services. And so there's a stigma with accepting one's ability to, or one's likeliness to have a mental health disorder, and comfort with seeking it and comfort with the label piece. Unfortunately, in order to seek services, many mental health organizations have to provide a label for service. And so that can impact how someone is open to seeking services. There's also a lack of representation of clinicians who look like us, right? So there are very few psychologists, therapists, psychiatrists that are Black and that are people of color. So with the limited opportunities to connect with someone who potentially has the same lived experience and background as you is limited, then you may be unlikely to seek that support. And so those are just a few of the many reasons why we have a lower utilization rate of mental health services across the country, across the world, really.
You were speaking about how many Black people are in the world of mental health or mental health practitioners, and I read a status that said it is only 2% of psychologists within the United States are Black currently. That's such a low number versus looking at what our demographics are across the United States as people of color.
Right.
To think about how can 2% of people that look like you and I address such a large need. I know that during the civil unrest here within the Twin Cities, there was a lot of talk about mental health services, as well as how do we support our men and women in law enforcement as they go out and go on calls. And most of the time they're saying that there's an alarming number of calls that are specifically surrounding mental health issues, that they aren't going to a situation of someone breaking in a home or someone stealing a car, but someone is having a mental health episode of some kind and they need support. We've seen that in the United States that the Biden-Harris administration has begun taking mental health very seriously, dedicating upwards of $7 billion across the United States to mental health resources and programming. Can you talk about the importance of that currently?
Yes, it's absolutely necessary. I think that we see across our country there has been, an increase in violence that's happened in our school communities. Um, there has been more people struggling with their mental health. And so absolutely there needs to be policy that move towards allowing different organizations to provide mental health services for all types of people. And I would also say it's not enough, right? So potentially some of these resources have been allotted for a period of time, and they may pay for one or two clinicians for about 1 or 2 years, right?
Okay.
And so thinking about their caseloads, many of the challenges that schools face, they may be met with different types of interventions and supports. So it could be met with individual therapy. It could be with group therapy. It could be with exploring, shared experiences and perspectives for the whole school community. And so there are many, many things that are impacted by mental health or that are contributing for mental health that look differently, right? So there are people who are diagnosed with anxiety, depression, and any other mental health disorder. There's also an increase in violence, right? We see many high schools having many more fights and physical incidents happening. That's a result of increased stress and difficulty coping, right? That's a mental health issue. There needs to be supports and funds that are allotted to that. And they need to be ongoing, right? When we think about the stigma and the many things that impact someone's likeliness to seek formal mental health supports, there is a lot of work that needs to happen over time. And so we need to have recruitment for mental health clinicians, specifically clinicians of color. We need to have ongoing financial and systemic support to support the need for mental health services. And there needs to be community collaboration. And so schools may have funds, but there are also outside agencies that they can partner with that can provide ongoing support for the mental health crisis that we see. So yes, it's wonderful that the Biden administration is allotting funds, and we need to think about the long-term impacts of not only the pandemic, but the mental health outcomes of all of the things that we've been experiencing.
I know that open enrollment is currently taking place for people to pick medical care. I was recently watching a television commercial that was saying Minnesota healthcare programs are now expanding to include healthcare services. Beforehand, I know that you had to either add it to your plan or you'd have to pay additional costs to receive any type of resources needed surrounding mental health services. So I can now begin to see that people are starting to take it more seriously and are starting to maybe think differently about the taboo that is attached to mental health disorders or even receiving any type of treatment.
Right.
What is another word of advice that you have to someone that says they're hesitant about seeking treatment for their mental health?
I would think that they would think about how, whatever they're struggling with is impacting their quality of life, right? And also broadening their perspective of what they think mental health and mental wellness is. So it doesn't always have to include formal therapy. There are different resources and systems that we tap into that provide respite and healing and support for us as a community. And so thinking about how you can reach out to people that you care about to explore some of the things that you're dealing with. Maybe ask questions about, do you feel like I'm doing okay? Do you feel like this is normal? Do you think I need some help? Right? And exploring that conversations with people that you trust. And also looking at your local community organizations. So what is great that I'm seeing in some spaces is that we are providing support for members of our community that don't look like the traditional services, right? They're not packaged in therapy. There could be community groups that are working together to support each other. It could be your local Y that has elderly groups, right? That helps elderly cope with the loneliness of being, on your own for a while. In my dissertation, I did research on how does the Black community find support outside of mental health services. And we know that barbershops and hair salons have been safe spaces for us to explore things that we're struggling with. And so I think it's important for you to not hold in your struggles with yourself, but to reach out to those that you trust and decide if you are really significantly impacted by your thought processes and what you're struggling with. And then hopefully at some point you'll have the strength and motivation to be able to reach out to more significant help as needed. And so that would be my hope, is that we have this perception, and potentially it's Eurocentric, right, of what mental health is. And it's really mental wellness. And so it's figuring out what coping skills would be beneficial for you to live a healthy and safe life. So it could be a combination of therapy, it could be exercise, it could be healthy eating, it could be a combination of them all, it could be medication in combination with that. So it's important for us to have a broader perspective of what mental wellness is and know what is really significant in your life to make a change.
That's very important. Thank you so much. Can you talk to me about how communities of color can address the stigma that's attached to mental health or receiving help with a mental disorder? I know that for many, there are things such as faith-based feelings around it. So they say, I put my trust in God. If I feel stressed out, I pray about it and I'll be fine. I don't need to talk to a therapist, or I don't need to take meds. Could you speak to that, please?
Yes, I think it's an effort that needs to be collaborative amongst mental health clinicians and different community organizations in which you just explored. So faith-based organizations working with those who are clinicians in mental health services, right? Creating different group programs that would be beneficial, that could explore things that people may be exploring and are struggling with, and give them tools to be able to cope with that. I see, and it's been a great thing, I've seen some faith-based organizations reaching out to the clinicians that they know and sharing that, I have this congregation member that is really struggling with this. Can you talk to them, right? I think that there is a need for more clinicians to be trained for faith-based organizations to be able to support those spaces. And there's potential opportunity from those organizations to partner. So I see partnering with different community organizations and mental health organizations. And then I also see a broadened perspective of supports. So it could be group events that could be scheduled and planned for celebration and support. There could potentially like men's groups that could be created to support men in their mental health and make them feel more comfortable in exploring the things that they may be struggling with. And youth groups for scholars to kind of explore what they may be experiencing, what they're struggling with, what successes they're experiencing. And so then it takes away the fear of being singled out and I am wrong and something is wrong with me. But this is a shared struggle that we may have. And how do we help each other get through our difficult times?
I think that's very important. Lastly, can you just provide one word of advice for those of us that are either navigating our own mental health or want to talk to someone about their mental health in our community? Can you kind of give us some advice on that?
Yes, I would say that, it's important to think about like what you want for yourself and potentially what you want for your family. And if the route in which you're going is setting yourself up to meet that goal, or is it hindering? And then if it is hindering, then it's likely that we need to make change to impact our livelihood and our family's livelihood. And so it's not a sign of weakness. It is not a negative, it's not a negative thing to seek help. It's actually one of the strongest things that you can do, because it changes your life and the lives of everyone around you if you take control of your life and your livelihood. So I think absolutely figuring out if you have all the tools that you need to be successful. And if not, reaching out to the spaces where you can get it, to be able to change the narrative for you and your families. That's the advice I would give.
I think that's powerful. Dr. Harold Woody Neighbors once said, "We are alone during the times we need to be together and lean on one another most." I think that's a very timely quote. I just want to thank you for your time today, and for not only the amazing work that you do every day with our scholars, but during this crazy time in our society, it's important to stay connected, and I appreciate you.
Thank you. Thank you for having me.
Many thanks to Shavita Prasad and her amazing team at Hopkins Public High School for their willingness to participate in this interview. I hope something that was said or done encourages you, inspires you, or you have found educational today. Remember that your mental health is up to you, and that you have all the right in the world and all the reason to change your perspective on it today. Thank you for joining me. As always, I've been Anna Orr, and I look forward to connecting again with you soon.